Dear all, I am going to tell you about the signs of meningeal irritation. On occasions in exam, examiner may ask you about those signs. It won't usually be a part of the examination, as signs of meningeal irritation are usually seen in those situations which are not kind of stable patients. So usually they are not part of exam. But if somebody asks you in a normal patient, at least you should be having a good idea that how to check for signs of meningeal irritation after sanitizing your hands, after approaching from the right side, introducing yourself to the patient, asking about his name, telling about your name, and then after taking consent, we'll be starting the examination. For that purpose, exposure is not needed in for the cases of signs of meningeal irritation. We can comfortably examine the patient with whatever dress he is wearing. So there are three signs. One is Kernig's, one is Brudzinski, and another sign is neck rigidity. So we'll be assessing for these signs: neck rigidity, Kernig's, and Brudzinski. Brudzinski is done in two ways, so I'll be describing it at the end. The important ones are Kernig's and neck stiffness. So first, you need to move the neck sideways, so that if somebody is having, say, cervical spondylosis, that person, or somebody is having some other kind of stiffness secondary to strychnine poisoning, somebody, which is very commonly you see, somebody has been given some injection like metoclopramide and he has developed EPS, a person can have that stiffness generally as well. So to look for that generalized stiffness, or if somebody is having generalized stiffness, these signs cannot be seen or elicited. This is only possible when otherwise body is not stiff. So at least for neck, you separately see this thing. You move neck sideways. दर्द तो नहीं है आपको कहीं? First I am asking from the patient whether he is having tenderness. थोड़ा सा ऐसे मैं मोड़ रहा हूँ, थोड़ा इधर मोड़ रहा हूँ. आपने बिल्कुल इसको ढीला छोड़ देना है. Now what I am supposed to do? I'll be bending his neck so that his chin will be touching his sternum. So this is what I am going to do. ये मैं आपकी थोड़ी सी गर्दन से मोड़ूंगा ताकि आप यहाँ पे ये नीचे लग जाए. ठीक है जी, बहुत शुक्रिया. So this is how you check for neck rigidity. It's very simple. Now checking for this next sign, this is known as Kernig's for meningitis. You need to first move leg that way. This is 90 degree perpendicular. Hold this leg that way. This is again 90 degree. And after holding it that way, now what I am going to do? I am going to straighten it up that way. So a person who is having meningitis, what will happen with that person? He will feel pain in that hamstring. As these meninges get overstretched, a person feel pain in these hamstrings. So that way you would be saying a patient's Kernig is negative. Remember, lifting that way, perpendicular, holding that way, and then lifting upward, pain feeling here in the hamstrings. Then finally, the next sign is Brudzinski. It can be done in two ways. One is by examining the neck, you check this Brudzinski in the legs. As you will move the neck, just as you did while checking for neck rigidity, patient flexes his knees. So that's what we call the neck Brudzinski sign. And the common one, or which is usually done in exam commonly, is the one where you examine that Brudzinski sign while examining his legs. Now here, it's not brought to that level, but it's brought to that level. You completely flex it. You flex it here, then you lift this limb. Now what will happen next? A patient who is having positive Brudzinski would lift his left limb, would flex his left leg. So what I am doing here? Now I am fully flexing it at hip joint. Now I am lifting it up. And what patient will do if he is having positive Brudzinski? He would flex his knee that way. So these are the three signs for signs of meningeal irritation. Thank you very much.